facial fillers that we use are actually things like hyaluronic acids, and hyaluronic acids have several different properties. Some of them are a little thicker, some of them are a little thinner, so we use them in different areas. Oftentimes we use Bolotero for the tear trough through here, but we also like to use Voluma or Restylane Lift out through here. The Voluma or Restylane Lift can last maybe up to 2 years or so, depending on the patient. In the nasolabial fold here, we like to use Restylane, Juvederm Ultra Plus. Those are really nice as well. So when we looked at her today and asked her goals, she pointed out kind of the upper area through here and then also through here. And I think this lower area is actually where she'd like to focus most of her energy. But I noticed that if we did too much through this area, it would look too full if we didn't complement it and bring harmony with adding a little bit up through here. The last thing that we'll do will be Botox, and Botox is FDA approved for the glabella area and for crow's feet, but we use it off-label for the forehead and for a little bit of a brow lift as well. So this will be a really nice treatment for you. You might have a little bit of bruising and a little bit of swelling, but I think you'll do just fine. Okay. So go ahead and close your eyes. I'm going to go ahead and I'll just touch your right cheek, and I'll be go ahead and working out through here. Okay. And I'll be laying little depots of the product and aspirating right before I do it. Okay. So I'm going to go ahead and start a little bit right through here. She's had some numbing medicine on, so that'll kind of take away the edge just a little bit. Just laying it along the cheekbone here. Little controlled injections. This is FDA approved for the cheek area. The Voluma is a great product, but it really needs to have some type of a backboard so that you can see it. If we used it down through this area, it's not helpful. This area is better for Sculptra or some other type of global product. This needs kind of a backboard in order to be able to see a little bit better. But the results are almost immediate. For a product like Sculptra, which is polylactic acid, that actually can take a couple months to start seeing a result. And Sculptra is best kind of given through the temple area and out through this area for global filling. Voluma is really indicated for this area here, and we use it off-label use for the temple too. Okay, so just for fun, take a peek and see.
I wasn't really sure what to expect, and that was awesome.
Now I'm going to add some through here, and this will add some more volume right through there. Okay. Oftentimes, people have aging and they don't really know why they look old, but I find that people really lose volume in the temples, and it's really kind of an area that people don't think about. They kind of focus on the front, but they don't really realize that temporal hollowing really adds to their aging. It makes them look more gaunt and more old. So the difference between this and Botox is that this is a filler. Botox is a muscle relaxant. So we use Botox in certain areas in the forehead and in the glabella, but Botox will relax a muscle and will help lift, whereas this is actually help plumping up little furrows or lines and things like that on the face.
I love it.
Do you?
I love the immediate results.
That's
really nice. Oh my gosh, it's a huge difference. So these lines here were the ones that were really bothersome to me, and they're almost gone. I mean, I barely can see them, and that's a huge difference, and I love it. It looks really good.
And a lot of people come in and they say they just feel like they're tired. They want just a little something to kind of perk themselves up, especially, you know, kind of 30s, 40s, 50s. I think people sometimes, you know, lose weight and they want to be in, you know, good shape, but they really lose a lot in their face as well. So these little things can really add up. So I really haven't called it the 5-minute facelift, but I'd say, you know, the 10-minute refresh, and this can actually really be helpful for people and making them feel good too. So good job, Missy.
Thank you.
Yeah.
Love it.